Hi, everybody. Thank you so much for joining this month's AOT Learning Network webinar. My name is Brooke, and I work on tax implementation team. Today, we are learning about supported employment in AOT. And I just want to take a minute to introduce my colleagues on the screen. And we have a new AOT implementation team member who's just joined us, Jared, and I'll allow him to introduce himself too, that we're really excited to have on board. Betsy, you want to go ahead first?
Good afternoon, everybody. Betsy Johnson here. Good to see you all. Thanks for joining this important webinar. We're thrilled to have Jared joining us today, and you'll be seeing plenty of him in the future. So Jared, tell us a little bit about yourself.
Thanks, Betsy. Hi, everybody. I'm Jared. I came from Northern Virginia Mental Health Institute, one of the state psychiatric hospitals, as part of the Department of Behavioral Health and Developmental Services in Virginia. So I come from the inpatient side of behavioral health, and I'm joining the implementation team and really excited to be with you all.
Thanks, Jared. So today's webinar is going to focus on the importance of advancing AOT participant employment goals. And we're going to start off with a presentation by Tabatha Burks. Tabatha is lead supported employment monitoring specialist with the Georgia Department of Behavioral Health and Developmental Disabilities. And she'll kind of cover the basics for those of you who aren't familiar with supported employment. And then after that, Tabatha's presentation will be followed by a panel discussion exploring supported employment for AOT participants in practice by highlighting the partnership between AOT provider Georgia Pines, CFB, and their supported employment provider AmericanWork. And our panelists include Todd Lynch, peer support specialist for the Georgia Pines AOT pilot program in Thomasville, Georgia, and Robert Howell, who is the supported employment coordinator for AmericanWork. Just a couple of really quick to-dos before we dive in. So registration was made available for this through the AOT Learning Network webinar. Some of you may have been forwarded a notice to join. We would definitely encourage you to join the AOT Learning Network if you're not already a member, and I will put the join link in the chat. It's totally free, and you can get access to kind of all things AOT and more events like this one. And then finally, please feel free to submit questions using the chat and the Q&A functions throughout the presentation. And just note that all questions will be addressed at the end. And with that, I'm going to go ahead and hand it over to Tabatha.
All right, thank you, Brooke. Good afternoon, everyone. I'm going to share my screen. Okay, wonderful. So as Brooke mentioned, I actually work with the Department of Behavioral Health and Developmental Disabilities. I'm the lead supported employment monitor that oversees the supported employment program. So what is supportive employment? That's the big question. Supportive employment is a mental health block grant funded employment program, and it was actually implemented in 2010 here in Georgia. The program itself is evidence-based, and it supports 8 principles. So that's what guides this program, those 8 principles. The program assists individuals living with a severe and persistent mental illness work regular jobs of their choosing. So that's a very important component of the program when you see regular jobs of their choosing. So the goal of supporting employment, the overall goal is to provide competitive employment to eligible individuals living with a severe and persistent mental illness who express a desire to work. So again, that's important. They must express a desire to work to participate in the program. The program is set up with 21 contracted providers across the state, and statewide we have 2,594 allocated slots. And those slots are actually broken down based on the providers. Supportive employment team consists of a supervisor and employment specialist. And again, that depends on the particular provider, it could be 3 or 4 employment specialists. It just depends on the size of that provider. As well as they receive support from the state office supportive employment team, which I am a member of. And we also collaborate, and we have a strong collaboration with Georgia Vocational Rehabilitation. So the fidelity process, every program gets an annual supported employment fidelity review. And what this is done annually, and it's conducted by the state office, again, which is part of the team that I'm a member of.
And hey, Tabatha, so sorry to interrupt you. If you don't mind putting I can see your slides, but they're not advancing. So if you don't mind putting them in presenter, I think if you click the from beginning button.
Can you see that?
Yes.
Okay. Can you see this screen here?
Yes.
Okay, I'll leave it there. Okay.
Thanks.
Okay, wonderful, wonderful. Do you need me to go back?
Are you maybe
okay?
Maybe just briefly so folks can see them.
Okay. So this screen here will just show you that it's 21 contracted providers and how many slots are allocated, which I mentioned. There are a little bit over 2,000 that's allocated across the state. And it talks about what each team is made up of, which is a supervisor and employment specialist. And just to kind of go a little bit into this, the employment specialist is the driving force. They're the important component that actually go out and assist these individuals in finding work. So they beat the pavement every day. So my role in this process is I'm more of a liaison, and I assist the providers where I can to ensure that the program is successful. So on an annual basis, my partner and I, we go out and we do annual fidelity reviews. And that's where we dive into the program just to ensure that the individual is getting the tools necessary to go out and work, and that they're happy with the program, because that's what's most important also, that the individual is happy with the services that they're getting from the provider. I mentioned earlier 8 principles of supported employment, and these are the 8 principles that we focus on. And we focus on these even when we go out for the fidelity review, which for a better term is audit, but we don't like to use that term because that's not how we view it. We view it more of a review of your program, just to make sure that you're being successful and the individual is getting what they need. So the 8 principles are: we focus on competitive employment. Again, that's employment that's for anyone. You and I can apply for. It's not based on your disability. Eligibility is based on client choice. So with our program, it's client choice. So if a person tells you they want to be a pilot, that's their choice. So that's the job that you need to focus on. Attention to client preferences, again, very important. Benefits counseling, rapid job search, systematic job development, integration of rehabilitation and mental health services, and time unlimited. You can stay in this program as long as you need our assistance. And the other really good thing about this program, when you see integration, we work a lot with the treatment team members within the organization, just to give that individual a wraparound service. So the big question is, how can AOT and supportive employment work together? Well, start the collaboration with a supportive employment provider. The first thing is connect with a provider within your region that's offering the service. Discuss the benefits to the individuals being served, because again, it has to be its client choice. It can't be where you would like your client to look for work, but your client doesn't want to. For us, the client has to want to work. That's the only way it makes the program successful, as well as the individual. Develop a plan to refer individuals to the SE provider for the employment phase. So that's how we can all work together, is first just building that collaboration and connecting the dots. And how do you locate a provider in your area? Of course, you can contact me. And I work with all of my providers are across the state in 6 regions. And I work with all those providers, and I'm more than welcome to connect you with someone that's close to your location or within your region. And that's it, Brooke. Are there any questions for me? And I'll be here for the entire workshop if questions come up later.
Thank you so much, Tabatha, for that overview. That was really helpful. So if we don't have questions now, I think maybe we just wait until the end. Also, I told everyone to wait until the end, so that could be it. But let's go ahead and jump into our panel. Alrighty. And so thank you again, Robert and Todd, for joining us and for sharing a little bit about what you do. I'm going to start with Todd. Todd, if you don't mind introducing yourself and just kind of talking about your role as it relates to working with AOT participants.
Absolutely, my pleasure. My name is Todd Lynch. I am a certified peer specialist with Georgia Pines. My role in the AOT program is to identify with the individuals on a lived experience basis, to meet them where they are, to let them know that there may be challenges, but there's nothing that's insurmountable, and help them find ways and resources to reach the goals that they set. So we work with all of the individuals referred to our program and admitted to our program. We make sure that they're getting the services that they need, the services that they want, and getting linkage to things like benefits, area resources, housing, and supportive employment. So I again, as a certified peer specialist, I have my own personal lived experience. I am in recovery from mental health and substance use challenges. I've got about just under 3 years of sustained recovery.
Congratulations.
And thank you. And I actually ended up in Georgia to just because I couldn't get the resources I needed where I was from in Maryland to make my recovery work. So I'm feel very blessed to have ended up where I am now.
Well, the program's lucky to have you, Todd. And before I move on to Robert, I just want to provide a little bit of context. So for those of you on this webinar, the state of Georgia has really taken the lead in spreading AOT across the state with a pilot project. And Georgia Pines is one of the pilot sites doing AOT. Todd, do you mind just sharing maybe an estimate of kind of how many participants you have on AOT right now?
Absolutely. And I'm very proud of the fact that I was apparently the first official peer specialist for an AOT program in Georgia. So I take pride in that fact. And also, I'm very proud of the fact that our program was the first to have a graduate that actually completed their mandate and the full year in the program. So I'm loving all the firsts. We currently have, I believe it's 17 under an active mandate, and we have petitions in the works for at least 2 or 3 more individuals. We also have several individuals that were referred to us from the local jails, and they aren't officially in AOT, but we are working to transition them and hopefully make that one of their conditions for release, or to just get them set up for success when they are released. We're working with 6 of those individuals currently. So
that's amazing. Yeah, we've had kind of a lot of talk about AOT being an option for those low-level nonviolent offenders who may not be restored to competency. So really exciting to hear that you guys are looking into that. And for the folks on this call who work in AOT programs or are aware of them, just to kind of put the number of participants into context, this could be wrong, but I believe Colquitt County is about 45,000 people, and I think Thomas County is about the same.
they're roughly that sounds about right.
Okay. All right. Well, Robert, same question to you. If you don't mind introducing yourself and your role as it relates to working with AOT participants.
Good afternoon, everybody. I'm Robert Howell, and I've been with the Support Employment Coordinator for AmericanWork for the past 25 years. And basically, we help clients find jobs all across the state of Georgia, in Columbus, Savannah, Augusta, Albany, Thomasville. And we've put over the years many people to work. And there's one thing I want to say up front, that the most important thing I'm going to say all day, and that is, work not only improves the client's lives with mental illness, and a lot of times it saves them. And I'm one of those people that fall in that category too, because when you have a severe and persistent mental illness, you spend way too much time trapped in your mind, and you can't make that go away. But if I can get somebody a job, get them to work, they've got something to focus on for that length of time other than what's going on in their head. And why I say not only it saves lives, I'm convinced, just like a heart surgeon will put a stent in, that supported employment can help, because I've had countless clients over the years that have multiple suicide attempts in and out of the crisis center, and they referred to us, and we get them a job, and all of a sudden they do much better. They're not in the crisis center anymore. So that's why I say, work is very important to recover.
Yeah, that makes a lot of sense. I'm curious, I guess this is a question for Todd, and then maybe Robert, you have some comments on this. How do you determine who to refer to Todd or to AmericanWork for supported employment?
Anybody who wants to work. That's it. That's the only qualification. Even individuals who aren't directly in our program, if they want to work, we will forward them, refer them over to AmericanWorks. But specifically with the AOT program, we got Robert and his team on board, from day one. And they were very excited to work with us because, I know from personal experience how important working is. I was on disability for 12 years. And by this job that I have now with AOT, I've been able to end my disability and completely go back working full time. I'm not even receiving those benefits anymore. And it's part of what has sustained my stability and kept me, moving forward, was having this purpose, this job, this structure. So I share that with individuals that we encounter. And if any of them say, hey, I think I might want that, I'll have the referral done before we stop talking.
And Robert,
I'm sorry. Yeah, I just
you're good.
I had to take myself off mute. And just to follow up on that, I think Tabatha may have mentioned it as one of the principles, but we have zero exclusion. Like Todd said, I don't care what barrier you got. I don't care if you're drinking every day. I don't care what you're doing. If you come in and say, I want to work, we're going to help you find a job. And that's our motto. And it's been like that all the time. And we've had client after client, and sometimes you get a client, they work a week and they might lose. And a staff will call me and say, well, they didn't work but a week and they lost their job. I said, well, that's a success. How many weeks they worked last year? None. So if they worked a week this year, a day, if they work from 9 o'clock to 10 o'clock in the morning, that is a success.
Yeah, I love that philosophy, because I feel like, maybe it's an assumption, but perhaps people in the lives of some of the folks that you serve have not believed that they could work. Maybe they don't believe themselves that they could. Is that ever a factor?
That's one of our biggest barriers, is stopping the family from interfering with a referral. Because we've had individuals, and it's not out of malice, it's not out of maliciousness, it's out of wanting to protect them. He can't go back to work. She's not in a good place to start working again. Well, but our goal is to meet their goals. And if they feel that they're ready to work, we're going to do everything to support that. You know, our program is not about agreeing with your decisions. It's helping you make the smart ones you want to make. So we've had some issues with family not wanting them to participate. And the other thing is individuals themselves. You know, I just don't think I can work, or there's no way I'm going to find a job, or just frustration after door after door after door closing. And that's where the partnership we have with AmericanWorks really is beneficial, because they know how to navigate those issues. So all we have to do is just get them on their referral board.
And one thing to piggyback on Todd, one advantage me and Todd both have is when they come in here and see it, and I don't know, I don't think I can. And then we tell our story and say, if we can do it, you can do it. And that's true. I've had many people, I just don't know. I don't think I can. I don't think I can. I said, yeah, you can. And and sometimes you just got to, like they say, you got to hold the hope until they can find the hope themselves, you know.
Right. And I think it's so powerful that you're giving people a chance when maybe they haven't had kind of a chance, or they've lost chances in the past, and the worst that can happen is they don't continue to work. So I think that's amazing. Well, what does you all's communication look like? Kind of the flow between someone wants to work, and then Todd, how do you refer them over to AmericanWork, and then what happens once you get that referral, Robert?
Because Georgia Pines and AmericanWorks already had a really well-established relationship, AmericanWorks is actually into our records management system. They're incorporated into it. So as we are meeting with individuals and documenting treatment plans and contacts and things like that, we can actually submit a referral directly in our system. All their information goes directly to AmericanWorks. They can communicate with us. So that's how we get the ball rolling. But once that referral has been submitted, we communicate with them daily, email, phone, text. The supportive employment specialists in the area will drop by the office when we're in Thomasville, or they'll drop by in Colquitt and, you know, give us updates on individuals, and even let us know, hey, you know, we've got a new employer that we're partnering with, and if you think of anybody that might want to work in this industry, you know, send them our way. So it's near constant communication.
Right. And what we do too is when we get that referral and it gets to Russ here in the office, we immediately send it out to team leads, and we try within a week to have them opened up in the system, assessed, because we don't have a waiting list here. I mean, I don't believe people don't want to wait to work, so I'm not going to make them wait to work. And we'll figure out a way, because we have we're so large, we have enough discharges, we almost always have enough space to add somebody. So we try to open them up and start working with them within the week after we get a referral. But that's kind of the way the flow works. And then, like Todd said, after we get them open up, after we meet with them, we start sending emails to Todd, tell him what we're doing, what we're not, if we couldn't find them, we can't find them, or whatever. And then he gets back with us. But that, and like I say, the other part of the communication is I attend all the AOT meetings too.
I forgot to mention that. Thank you, Robert. Robert's been great about that. Any meeting we have, if we have a treatment team meeting and we put the invitation out to AmericanWorks, they will send somebody. A stakeholder meeting, a training, they're there.
That's huge. I think that really, that collaboration is really what the spirit of AOT is. And I love to hear that there's not a waiting period. So I'm guessing you really need to jump on it when someone wants to work. That could be a fleeting interest, and so you want to get them work as soon as you can. I'm curious about, if I know we kind of touched on this a little bit, but if there's any exclusionary criteria, if there would be any reason why someone would not fit.
The only way, Brooke, that we can't open up somebody with SC is, the only exclusion is, number one, if they're transferred over to the ACT team. It's an ACT team that works with, I'm sure most of y'all are familiar with that. and they have their own vocational specialist. So if that happens, and it has with a lot of our clients, we'll make a smooth handoff over there to their employment specialist. And also, as far as any other exclusion, the only thing they cannot have is and 9 times out of 10, you won't see this anyway, but if they're just strictly substance abuse related, like cocaine dependence, something like that, methamphetamine abuse, but if they don't have a mental illness with it. But as long as they're duly diagnosed and have a severe and persistent mental illness, they say we want to work, they want to work, we'll get them a job. I mean, we don't turn anybody down.
And I just want to add on to that. AmericanWork specifically has been very good about, if we refer an individual and they start working with them, and then suddenly the individual changes their mind. I don't know, that this isn't for me. I don't think this is going to work, or they just ghost them. They're very good about, if we can get them back to a better place and they decide that they want to try it again, they will pick right back up where they left off and jump right back in with both feet. It's, it's not a, well, we tried and it didn't work, you're done. It's, you want to work, we're going to get you working.
Amazing. Well, I'm curious what I think we talked about this a little bit with family, but what kinds of challenges or barriers y'all see for AOT participants in supported employment, and how you address those?
Well, I'll just say the one thing we do is, as far as Social Security, we have we always link every client that comes into SS to support employment with a Social Security office, so they can get their I think it's BQI, something like that, to see how much they make, if and for it affects their check. But like Todd said, now that is a barrier that we run into, where family members are, even though the client wants to work, the family member is really, really resistant to it, because they don't want their check cut, because they're the ones getting their check. So, and supporting them. So they're real hesitant for them to go to work. But basically, the way we overcome that is we actually try to meet with the family member. We show them exactly how much through Social Security, how much they can make with it affecting their check. And then they kind of go from there. Now, sometimes the family is still just like, he just cannot work. But I will say, for the most part, over time, it's just about education and them understanding. And then if the client keeps expressing desire, more times than not, they'll kind of end up, say, okay, well, let's try him working 2 hours a week or 3 hours a week or something like that, so it doesn't affect his check. But that is I'll be honest with you, all the barriers of support employment, the legal issues, the lack of work history, all that, the biggest barrier for this is the clients that are on Social Security, that they have a family member trying to provide resistance to them to work. And that is probably the biggest barrier.
And on the flip side of that coin, we have another barrier that we run up against often, is managing expectations, because we have family that is on board with AOT. They're on board with the court's involvement. They're on board with the structure. They're on board with supportive employment, but they expect, as soon as the judge signs that order, that they're going to leave the courtroom and that individual is going to go right into their next full-time job. And that's not a reasonable expectation. They need this supportive employment assistance because there's barriers that have to be overcome. And that takes a little bit of time. That takes knocking on doors and beating the pavement to find the job that's going to work. And as long as we can set those realistic expectations from the start, it really does help make the process flow a little smoother.
Brooke, I just want to follow up on the SSI question, just because I know there's a lot of questions about that. I wonder, Robert, maybe could you give us sort of an example of a typical case of somebody who was getting SSI and they got a job, and how much how that specifically impacted their SSI, like in terms of dollar amounts? I don't know.
Well, I tell you, what we do is, and I'll be honest with you, Tabatha's on here and she can, the problem we got now, because we don't get in when I tell you about talking to SSI, we make sure the client and the family member directly talks to Social Security and not us, because with the government and the Social Security, it changes like the weather does. So I don't like to quote somebody saying, you know, they have a little red book, which what you can get it. I think it's free on the internet, but it basically goes over like the benefits and how much you can make and what the cap off is. And I don't know all the numbers off the top of my head, but I tell people all the time, you need to call Social Security and get that BQ, I think it's BQI or something. Tabatha, help me out. Do you know what it is?
I think you're right. That's the red book and the information, what they call it. Yeah, the BQI. Yeah.
I think that's what it is. But anyway, we make sure they tell them the information, because as a supported employment provider, that's not my expertise. And I do not want to say, okay, this is not going to affect your check, and I make a mistake and their check goes down and they coming in here, Robert, you told me this was going to affect my check. So I don't get into that. I let Social Security handle that. But that is a challenge in the state of Georgia right now. We used to have benefits navigators in every region through VR, and they would call and meet with the client and all that. Well, due to funding issues, that were cut. Where Tabatha in her office, not right now, because the problem we're running in now is Social Security so slow. You call them on the phone, it's a long waiting period, clients get frustrated. But the state, they're working right now with the providers to find another way of doing this, because that is just a huge challenge right now.
And it's BPQY. I had to think about it. Yeah. Yeah. And as Robert said, that is a huge challenge that we're trying to work through. And there's so many obstacles, as Robert mentioned, that go along with that, because you are dealing with the federal government and someone's benefits.
Thank you all for expounding on that. Yeah, I think we have a lot of Social Security questions in the chat. Well, any other barriers, Todd or Robert, that you all see? What about kind of at the individual level for your participants?
That a lot of times when we encounter someone, because of the nature of the program, they've been told no, or they can't, or they shouldn't, for so long, to many different things, to getting into recovery, to remaining sober, to taking their medications, to working again, that they've adapted that mindset. And that's part of what, what our team lead does, with the clinical aspect and the therapeutic aspect, part of what I do from the peer perspective, and our case manager as well, is, get them to understand that, yes, you've been told no for so long, but the answer can be yes. And this is how we do that. We're in the business of building people up, not tearing them down. And so you got to build up with positives. You got to find the strengths. You may have a criminal record a mile long, but we can find a job that'll work with that. You may not be able to stand for an entire shift in a warehouse position. Well, we'll find you an office job. There's options to be found. It's just getting between the relationship that we have as the AOT support team and the relationship that the SE specialists have. It's just kind of drawing that out and rebuilding that mindset.
And one thing I want to add to this, y'all, especially with AOT clients, obviously a lot of the barriers is they do have a lot of legal issues. They've been in trouble, and then in their mind they say, well, I can't work, Robert. I mean, my background, I've been in prison for 10 years, and I mean, I don't have any work history. I can't get a job. I say, yes, you can. There's ways around it. And what we do is this. One way around the legal stuff is, after they've been in our program and Todd's program, We write letters saying we're working with this person. They're complying with treatment. Please give them a chance. I get the clients that are enrolled in SC from AOT and others that have a long history of legal issues. I say, I want you to write a letter. I help them write a letter. Say, my name is Robert Howell. I've done all this, but I want to change my life. I'm turning my life around. Please give me a second chance, and have them sign it. And when you do all that and have all that backup, and a lot of times even a probation or parole officer, depending on the one, a lot of them, they're even willing to write a letter and say, look, this guy's doing everything we got. We'll get him a job. And one quick story, very briefly, we had a client not long ago, a year or so ago, that come out of prison. He was in prison for 30 years, 61 years old, no work history, no house, no nothing, homeless. He got out. Georgia Pines assisted him getting a housing voucher, referred him to us. We got him a job at a restaurant. He did good, worked. They gave him a promotion. He bought him a car, and he went and actually started raising money for the Georgia Mental Health Consumer Network, and actually went from somebody being and got the Peer of the Year award at their benefit. So he went from somebody that did a terrible thing in prison for 30 years to completely turn his life around. And Todd and me and everybody in this field, I mean, we believe in second chances. And sometimes, like Todd said, we have to get them to believe in it. Now, I mean, it's hard because there's been so beat down. They've, like Todd said, no, you can't do it. No, you can't do it. So we do a lot of building up in this business.
And Brooke, I would like to say something what Robert and Todd mentioned, and Robert just said it, how we do a lot of building up, but it also it brings about another important part to this entire puzzle, and that's your staff. You have to have staff that believe in the process and believe in recovery, because you have some situations where you have staff there, it's just a job to them, which means the message is not going to get to that individual as being sincere. So you have to also be careful in who you're putting in place to represent you and to help that person.
Thank you, Tabatha. That's super important because, just like talking with Todd and knowing Todd, I can see, and Robert, how that passion is there. But I imagine that especially when you're working with someone who might be nervous or apprehensive about working, you need to kind of be their cheerleader a bit.
Right. And one last thing to follow up, what Tabatha said. Somebody asked me one time, well, you don't have much staff turnover. What are you doing? And I say, well, I hire wounded healers. And they were like, what are you talking about, a wounded healer? Well, wounded healers like me and Todd and other people that have severe challenges in their life, that overcome challenges in their life, whether it's their own mental illness like me or Todd, or a family's mental illness. So those type of people, like Tabatha says, they're going to automatically have a deeper empathy and sympathy for the population than somebody else. And not nothing against the other people, but they just don't have the lived experience. And lived experience is just a huge with this.
If I didn't think it might result in me having to wear a skirt and pom-poms to work, I would change the job description to read the first entry as cheerleader, because that is what we do constantly. Is build up these individuals, let them know you can do it. It is possible. You're doing well. Keep going. And it's great.
Well, I kind of want to go back to Betsy, you want to jump in?
Oh, I don't mean to interrupt you, Brooke, but I'm curious, how much effort goes into finding the right job for the individual? Can you talk a little bit, maybe give us a couple of examples?
Well, like Tabatha says, what we do is we don't just go out there and randomly try to get jobs for people. They come in and we do this little short work assessment. It's very short because we don't spend a lot of time we put them in the car and get them a job, but basically it's where they want to work. And we try to get them to narrow it down to like one goal. instead of having, well, I'll just work anywhere. Well, if they say I just work anywhere and you just get them the first job without knowing their work history, what they enjoy, what they like, you're pretty much setting them up for failure. So we try to get them to tie down a one work goal. It might be stocking shelves. It might be sales work. Whatever that one goal is. And then we go and search for that one goal. Now, if they change their mind over time, we will change the work goal, of course, according to them. But we try to get them to, we find out what they want to do, what they like to do. Because if you get somebody in just any kind of random job, the likelihood of them succeeding is not near as much as getting them in a job they wanted. You know, and even if they come in, I'll give you a prime example. We had somebody come in and they wanted to race cars. Well, obviously, that's not an obtainable employment goal as being on the NASCAR circuit. But what we talked to them and they enjoyed cars, wanted to be around a car. So guess what we did? We got them a job in an auto repair shop and they cleaned up in there and helped bring tools and things like that. And they was just as happy as they could be because they met their goal. I mean, in a sense, they knew that was the best way, the way to meet the goal. And who knows, in the future.
Thanks, Robert. I think that's really a really important aspect because you're customizing it, and you're looking to what the individual wants. And it makes sense to me that if you put them in any job without doing that first, that it might not work out. So I think we've kind of touched on this, but what do you say to someone that, say you connect them with employment, they go for a day or maybe a morning shift or something, and then they just can't show up again. They struggle with that. What would you say to them?
Well, on our end, like I say, we just, because that does happen. Somebody comes in and they're all gung-ho and then they get sick and they have a bad day like we all do, and then they don't want to work. And we don't rush. That's why it's important to be patient because, you might have somebody come in today and be really, really eager to work and doing everything they need to do. And then you call them and set them an appointment to take them find a job. And they just say, I can't do it. I'm too sick today. Well, that's part of mental illness. You're going to have better days than others. So what we do, we just encourage them. They don't give up. You just having a bad day today, but when you feel better, come back in. And if you do that, then more likely they always come back in. We make sure we don't. If somebody comes in and they're not very cooperative, we make sure we give them. The only way we discharge or transfer people out of SE is if they say, I don't want to work anymore. If they come out and say that, now, if they only say that one day, we don't say, okay, I'm going to discharge you today. We're going to wait and make sure that just wasn't a bad day. But if they tell you repeatedly over a month that they don't want to work, then we'll move on. But we just make sure we understand that people are going to have bad days. I mean, all of us do, whether you got a mental illness or not.
And just, from our end, it's reinforcing that with these individuals. Not every day is going to be peaches and sunshine and everything is going to be wonderful. That's just reality. But it's helping to give them the skills to navigate those bad days and to pass those challenges and realize that just because you tried something once and it didn't work doesn't mean you can't ever try it again. And encouraging them to try and find what works for them. I mean, every single path to recovery is different. The goal is recovery, but how you choose to get there is going to be completely subjective to your experience, your symptoms, your challenges. And that's one of the things that I absolutely love about this program that Robert has. And also the ACT team and our in-house seed employment specialists is that they're willing to understand that, they're willing to accept that and work with that. Everybody's going to be different, so we'll customize as we need to.
Thanks, Todd. Betsy, did you have a question you wanted to add?
No, I'm just gonna let you know the questions are backing up.
Oh, okay.
A whole host of them.
Well, we just have just a few more, and then we'll get into those. Thank you to our audience for being so engaged. So, I know we talked about the flow of communication, and that once you receive a referral, Robert, that you'll follow up on it. I think, or maybe Todd said this, within a week. How soon could someone expect to actually be on the job from the point of saying, I want to work?
Well, that's a good question. And that is very individualized though. I mean, sometimes, like I say, we get an open, and once they're open, we get them in the car, we meet them, we take them around looking for jobs. It could happen as quick as that day, or it could be happen a month or 2 months or 3 months, which is okay. And you got to remember too, is how you measure success. If you've got a client in AOT that's trying to work, trying to get out there, just the act of getting him in the car, going here and there and applying is experience. That right there is invaluable. Even if they don't get a job for it, they might get a job, like I say, that day. It might be 2 months, but just getting them out and about and trying to do something, that's a huge success just right there.
And it's huge in so many ways, because a lot of times they've never had anyone in their corner like that, willing to go out and go door to door with them and coach them through an interview, or help them get the clothes that they need if they do get a job. They've never had that experience for whatever reason. And just to have that can be so impactful in and of itself. So I mean, the whole process is vital.
Thank you. And one thing that I would love to hear you talk about a little bit, Todd, that I think we discussed when we met to talk about this, is that so AOT, in an AOT program, you're monitoring an individual in an outpatient setting, and whether or not they're attending their appointments with Robert or AmericanWork or showing up to the job, I think you mentioned could be a good kind of pulse check on how they're doing. Can you talk a little bit about that?
Absolutely. And I call them in our program smoke detectors, because, it lets you know, hey, there might be a problem here that, beeping goes off, you check the smoke detector. This is one of those, because if we have an individual who is consistently showing up for appointments and engaging with us, but we set them up with AmericanWorks and they don't show up, or they're dodging phone calls, that's a sign, hey, maybe we need to check in and see if something's wrong. It's the same why, we encourage a lot of our individuals to switch over to long-acting injectables if it's appropriate for them, because that acts in the same manner. You get an individual who gets tired of being asked, did you take your meds? Did you take your meds? Did you take your meds? But if they miss an appointment, that's not that much of a bother to them. So it's little things like that we can put into place. And that's why I love working with AmericanWorks, because they're aware of that. They understand that, and they'll reach out and say, hey, maybe you guys want to check in with this guy. He was doing really well, and we've been doing a lot of job hunting, and now I can't get a hold of him. I can't reach him. He's not showing up. So that kind of puts us on alert to get out in the field and make sure everything's good.
Yeah, that's huge. I think just having more eyes so you can better support the folks in AOT that's really great. Well, one last question, and then I'm going to move into our Q&A. So you all, as we've seen, you've developed a great partnership. And it sounds like AmericanWork and Georgia Pines have been working well together for a long time. But I would love to know, for other AOT programs that don't have a relationship with a supported employment provider, or it's not something that they're prioritizing, what advice you would give them to kind of develop that partnership?
Oh, and one thing I'd say with that, Brooke, too, is, we had a head start down here with AOT because I've been here 25 years. So I've had a relationship with Georgia Pines for 25 years. A lot of people don't have that. But what I would encourage everybody to do that has an AOT program in the state of Georgia that doesn't have their own supported employment contract, because we do, like we've got an AOT program in Augusta with AmericanWork, and we have a supported employment program. So they're already talking. But if you have an AOT program that you don't know who your provider is, I would email Tabatha. She gave her information before, because there's a bunch of providers across the state, and there's several sometimes in some locations, but Tabatha kind of will know which one to guide you to. But if you don't have a relationship, like Tabatha said, that's the first thing to find out, is which provider is closest to you that you can collaborate with.
And to add on to what Robert just said, what we're doing here today, there are so many people and there's so many misunderstandings and unfortunately some misinformation about what AOT is and what it does and what it can do and what it can't do. Just educating the individuals in your service area, whether they be consumers or allies or collateral contacts or even employees in your own agency, just getting that understanding of what it is. We are a framework. We're not out to put anybody under a mandate. We're not out to tell everybody what you have to do. We're a support framework to make sure that no one falls through the cracks. And it's not just reminding people, hey, you got a doctor's appointment, you got to take your medicine. It's all of these aspects of the supportive employment, linking them to housing, case management. It's all of that. And having those connections is just essential, and just keeping a communication.
Thank you, Todd. And I'll add for the folks on the call who are not located in Georgia, feel free to, I'm going to put the email in the chat, email us to aot@treatmentadvocacycenter.org. And since we work with programs nationwide, we could probably put you in touch with someone who may know more about supported employment in your area. All right, well, that was awesome. And we've got a lot of questions for y'all. Betsy, do you want to start with the ones in the Q&A?
Sure, I'll just kick it off. So Jerry asks if you can talk a little bit about the relationship that that your program has with your state vocational rehab program. How do you all work together, and what's that?
That would be me. Basically, we have a contract. Every provider in the state of Georgia should. There might be a few that don't, but we have a separate contract with vocational rehab in the state of Georgia to provide IPS supported employment. And we basically, clients that are referred to us from Todd, or not AOT, necessarily just AOT, any type of service at Georgia Pines, they refer them to us, and then we refer to VR, and we work collaboratively with them. But we have a separate contract with them, to answer the question.
And AmericanWork is going to be our conduit into VR, but making sure that our staff is aware of it and knows what it is, what they do, that it's an available resource. Because we have some staff that didn't even know what VR was, and they're now getting some services from them.
Jerry had a follow-up question, also asked, and I think you touched on this already. You don't have a wait list, I take it?
No, ma'am.
Okay. That's awesome. Okay. Go ahead. Brooke, do you want to go back and forth, or how do you want to do?
I'm muted. Sorry about that, everybody. Yeah, I'll go to the chat. Let's see. So Sonia's asking if y'all are, or if this would be for you, Todd, if you're accepting people with IDD into AOT, intellectual disabilities.
It is, if they're only IDD, if their only diagnosis is IDD, that is a exclusionary criteria through DBHD in the state. But one of the biggest inclusionary criteria is would they benefit? So if they have co-occurring IDD and mental health or substance use, we will certainly consider it. But if it's not something that's going to be beneficial for that individual, it's not something we're just going to automatically pursue. So no, IDD is not an automatic exclusionary unless it's the sole diagnosis, but we definitely do take it into consideration.
Thanks, Todd. And I'll just add that Treatment Advocacy Center recommends that, or basically the guidance is someone with IDD could be an AOT if they have that co-occurring, but they need to be able to understand that they're under a court order. And so if they're a person that would have difficulty understanding that, it's probably not going to be of benefit to them.
I'll ask a question. Marla asked about how you deal with transportation, or what if somebody doesn't have a computer at home and needs a computer for their work?
Okay, as far as the transportation part A of the question, what we do in most of these areas is there's there's transit systems or buses or whatever, and we utilize them the best we can. We'll actually, if we get somebody a job, we'll actually buy them a bus pass to get back and forth to work so they get paid. We also, in the rural areas in Thomasville, we think outside the box. If somebody lives a half a mile and they like to ride bikes, we'll purchase a bicycle for them and they can ride the bicycle back and forth to work. So we do that all the time too, purchase bikes. The part B of the question, right quick, I completely forgot. What was it?
A computer? Is there?
As far as the computer, now when you get into something like that, that's when we try to link them to VR, and because sometimes VR will approve purchasing of a computer or something like that. But for bigger purchases, we generally go through VR for that.
Awesome. Robert, Nicholas is asking if you could share a copy of the short work assessment you mentioned. I'm not sure if that's something you can do or not.
Well, no, I to be honest with you, I can't. What I saw that pop up in the chat, and what I can do is I can send you a blank copy of it tomorrow, and you can forward it to me. That'll work.
Right.
Marcia wants to know, Todd and Robert, if you're available to talk with her brother in Hawaii.
Is that virtual or in person? I mean, if that's an invitation for an all expenses paid trip out there, I'll talk all day long.
I think y'all know by now, me and Todd will talk to anybody. So if she'd like either one of us to talk to their son and try to help him, we just, all they got to do is call us and we'll set up a Zoom with him.
That's awesome. And just for folks to know that this is being recorded and you all will have access to the recording very soon. So Brooke will get that out to you. So Marcia might want to share it with his providers.
All right. So Sonia's asking if you include occupational therapists for those who might need added support, Robert.
No, we don't do that. Now VR does that. If they needed something like that done, we can refer them off of us and to them. But we strictly do IPS supported employment, which is rapid placement. We get them, do a short assessment, we get them a job. So no, we do not do that piece.
Got it. Good questions, guys. And Jonathan is asking, what does the supported employment support look like after they get the job? And is asking if you use the IPS model, which I believe you just said. Right.
That question's easy too. We do use the IPS model, and then the support after the job is as much as they need. Sometimes we go by there depending on disclosure. It's the client's preference whether we go on the job or not. But if they want us to come by there and they having a bad day and want us to talk to the manager, we'll go up there and do that. If they want us to come by and support them at the house, we do that. But we keep them. We don't. Our general rule is after we get somebody a job, we don't even, we do a step down plan eventually, but we don't start talking about stepping somebody down from SC to after about 6 months, because that way we know that they've got time on the job, you know, they feel more comfortable, and we give them all the support they need. And then after the 6 months, like Tabatha said, it's time unlimited. So if they still don't feel comfortable, we keep them as long as we need, but we see them a minimum of 2 times a month.
Can you talk a little bit more about disclosure? I had a question about that. I mean, what if the person you're serving, you know, doesn't know how much they want to share? What would you advise?
Well, you know, the way we do it, like I tell people all the time, and I saw that pop in there, you know, you don't go to somebody's job and say, well, oh, here's Robert. He just got out of state hospital for schizophrenia. Do you have a job open for him? But you just kind of, you sit down with a client. We have actually a disclosure form, and it tells exactly what they want to disclose about their mental illness, about whatever, you know, sometimes they just want it basically their work history. And then we just go by that. And the client sometimes wants us to go in there and interview with them, or sometimes they want us to fill out the application and interview themselves. So it's strictly up to the client. And we disclose as much or as little as they want. But to be honest with you, most of the people, when even somebody that obviously that wants us to go in with them, and you can obviously tell they might have a mental health challenge, 9 times out of 10, the employer, he's not worried about the mental health. He ain't worried about nothing. He's worried about whether they're going to work or not. And if you go in there and say, look, I'm Robert, if you give this guy a chance, I'm going to come by and make sure he's working right. I'll do whatever I can to support him on the job. I mean, he's more worried about that than he is being hospitalized a year ago for bipolar disorder. But so that's the way we do that. But we disclose, like I say, is little as, and as far as we don't get into really guiding them about it, like we let them strictly 100% make that decision.
Robert, Ari is asking what strategies y'all use to initiate and cultivate relationships with employers on behalf of your clients.
Well, what we do is like I think Tabatha mentioned it. We make sure we hire the right people that are willing to go beat the streets down. We go knock on doors. Are you hiring? Are you hiring? Are you hiring? We don't just look on Indeed or look in the paper. We go from job to job to job, either with the client or without the client, find out who's hiring, and then whichever client and match the job to the person. But we basically just have to knock on a lot of doors.
And also, you know, if we come across just in our personal relationships or professional relationships, if we come across an employer that's has got positions and looking to hire, you know, we'll send them AmericanWorks way and say, hey, you know, make a connection with these guys. They might be able to find somebody for you.
Thank y'all. I think that might have been the last question, but last call for those of you who have anything you want to ask, feel free to put it in the chat. And I also, just to let you all know, I put a little blurb in the chat. If you're looking for specific support for a loved one, Treatment Advocacy Center has a helpline for family members, and they're really great. They can help you navigate resources in your area. So the link to contact them is in the chat if you're interested. Well, I think that is it. Thank you, Robert. Thank you, Todd. Thank you, Tabatha. This was excellent. And you've given us a lot of stuff to take back and use. We're really grateful for your time.
Thank you.
Everybody.
All right. Have a great day, everybody.
All right.
You too.